I'm going to go ahead and get started. It's 2 o'clock now. I see some people are still joining, but we'll go ahead. First of all, hi, and welcome to the OCI DHS Partnership Advisory Council meeting for today. My name is Rebecca Rebholz, and I am the administrator for the Division of Market Regulation and Enforcement at OCI. I'm going to be taking us through the agenda for the meeting today. So first, if we could just do some quick introductions of the advisory council members who are here just to start off. As I said, I'm Rebecca Rebholz from OCI. And if there's a DHS representative, maybe Anne or Claudine.
Yes, hello. I'm sorry, I must have joined a minute late. Are we doing introductions?
Yes, I thought we'd start with that.
Great. Yep, hello, I'm Anna Ben. I'm the Deputy Medicaid Director representing DHS along with my colleague Claudine.
Good afternoon, everyone. I'm Claudine McCarthy. I'm the Director of Communications for the Division of Medicaid Services.
Thanks, welcome. And are there any of the working group leaders that would like to just introduce themselves briefly? We can start, I think, with Bobby Peterson. I know I saw you on here.
Right. Hi, Bobby Peterson. I'm a member of the advisory committee, and I've been chairing the capacity and workforce direct assistance work group for the advisory committee.
Welcome. And the data working group, Melissa Duffy.
Hi, Melissa Duffy with Common Ground Healthcare Cooperative, and I have been leading the data work group, as mentioned.
And then Adam for the outreach and education work group.
Adam Vance Van Kuren, Navigator Program Manager with Covering Wisconsin. As mentioned, I am coordinating the outreach and education work group.
Thank you. And then promotion and marketing work group.
Hi, I'm Stephanie Sievers. Yeah, Stephanie Sievers, and I'm also from Covering Wisconsin, and I'm co-leading the promotions and marketing work group.
Great, thank you. And I'm sort of new to this, so is there anyone else from the advisory council or working group that's on that would like to introduce themselves?
I'm Donna Friedsam. I am with the University of Wisconsin Health Policy Programs Director in the Institute for Research on Poverty. And I've been leading, along with Allison Espeseth, the Key Performance Indicators subgroup.
Thank you.
And I'm Allison Espeseth. I'm the Director of Covering Wisconsin. And I've been on several of the work groups.
Great. Okay, was there anyone else who'd like to introduce themselves from the groups?
Hi, I'm Mark Huth, CEO of Group Health Cooperative, and I'm here representing the Wisconsin Association of Health Plans.
Okay, thank you.
Jennifer Wakowiak, representing Advocate Aurora Health.
Hi, this is Joanne Alleg, and I'm representing the Wisconsin Hospital Association.
Hi, this is Joy Tapper. I work with the Milwaukee Healthcare Partnership, and we partner with Covering Wisconsin to lead the Milwaukee Enrollment Network.
Hi, this is Shannon Drake-Burr. I'm with the Wisconsin Primary Healthcare Association, and I lead the group of certified application counselors that are staff at community health centers across Wisconsin.
Hello, this is Michelle Reinen. I'm from the Wisconsin Department of Agriculture, Trade, and Consumer Protection.
This is Laura Sutherland. I'm also with the Department of Agriculture, Trade, and Consumer Protection.
My name is Lars Brown. I'm with the Department of Corrections.
I'm John Rathman with Outagamie County Health and Human Services and represent the county IM agencies across the state.
Hello, my name is Christina Orr, and I work at the Milwaukee VA Medical Center.
Hi, this is Danielle Cotter. I'm with Children's Community Health Plan, and I'm also representing AHI.
This
Hey,
is Matt
was it-
Schaefer with Medica Health Plan.
Okay.
Hi, I'm Nancy Wenzel, Wisconsin Association of Health Plans. I'm Mark Huth's alternate, but are also decided to join today.
And this is Kelsey Avery, also with the Wisconsin Association of Health Plans.
Okay. Was there anyone else, or are we good? All right. Well, hearing no one else, first of all, I just wanted to say thank you to everyone for all their hard work and their dedication to the council work groups. OCI is happy to be part of the work being done to help enroll more Wisconsinites in healthcare insurance plan and Badger Care. We all know that having a unified message across the state for open enrollment will allow us to better leverage the engagement our partners have with their natural audiences. And while this year presents its own unique challenges with the election and COVID, et cetera, we're excited to continue to work to make health insurance resources more accessible across the state. And with that, I'm going to move into agenda item number 2, which is an OCI DHS update. I'll start with OCI's update. As you know, the OCI DHS Healthcare Coverage Partnership was created by Governor Evers in the summer of 2019 with the focus of enrolling more Wisconsinites in high quality, affordable health insurance coverage. The partnership is focused on improving coordination between DHS, OCI, and the numerous stakeholder organizations that support and promote consumer outreach, enrollment assistance, and overall well-being. I'm just going to touch on 2 recent partnerships initiatives that bear mentioning, and then I'm going to leave the detailed discussion to the various working groups as they provide their updates. So the first initiative I wanted to mention is the creation of wiscovered.com website, which was launched earlier this summer. The new Wiscovered website is designed to connect Wisconsinites with free expert help to get health coverage. Information is available in English, Spanish, and Hmong, and it helps put people in touch with assistance from organizations like Covering Wisconsin and United Way's 211 helpline. It also includes information about how to access health insurance on healthcare.gov and Badger Care Plus, along with other resources. The wiscover.com is a mobile-first website, meaning that it was designed to work best on smartphones for Wisconsinites who may not have access to a computer or who lack internet access at home. We've already seen some positive engagement through Wiscovered, and we're pleased to be able to create this resource with DHS as another way for people to access important information to get healthcare coverage. The other initiative I want to mention is the recent letter that was sent from Commissioner Mark Afable at OCI and Secretary Designee Palm to Health and Human Services Secretary Alex Azar and CMS Administrator Seema Verma. And the letter requested an extension of the ACA open enrollment period through the end of January 2021. We're pleased that 30 Wisconsin organizations, including major healthcare systems, insurance companies, prominent healthcare trade groups, local county health departments, and other important stakeholders joined DHS and OCI in supporting the request. So as everyone knows, with the significant economic disruption caused by the pandemic and the tens of thousands of Wisconsinites who have lost their jobs and as a result lost their employer-sponsored health insurance coverage, we know that it's critically important to give people as much opportunity as possible to get enrolled in new coverage. And that's why we're strongly supporting an extension of the open enrollment period. And we're hopeful that HHS will look favorably on our request and will get a response back to us quickly. And so then I also, just as part of the update, was going to briefly touch on a couple of OCI specific areas that impact healthcare coverage and enrollment in Wisconsin. For those who don't know, OCI has long tracked enrollment in the marketplace and worked to ensure that there are insurance carriers participating in the marketplace in each Wisconsin county. We maintain a healthcare coverage map showing the carriers in the individual market on our website currently, and things are looking good for the 2021 year. We expect to receive the final list of issuers from CMS. That should happen this week, and we're going to update that individual map on the OCI website by the end of next week. That update will include specific issuer names by county. And also for 2021, the rate filings that we've seen so far indicating that we can look for another average rate decrease, and another carrier is re-entering the market. And we're looking at some continued service area expansion. And this is all assuming that the carriers sign their QHP agreements with HHS. But Kelsey, if you could show the slide that I have. I just have a slide that's a real general, this is what we're expecting, and there's no promise or guarantee because again, the QHP agreements have to be signed to make it final. But if you can see this map, it shows the 2020 coverage map and then moving to the 2021 coverage. And as you can see, we're looking at expanded coverage, more carriers in a lot of counties, and in general, a real improvement, I think, in that area in the healthcare market. And just as background, OCI also has a consumer affairs section, which monitors complaints that consumers raise with regard to their insurance coverage. I checked in with our team of health insurance examiners in preparation for this meeting, and they're reporting that they've seen a few inquiries about open enrollment, but at this point, they're not seeing major concerns or problems with the enrollment in the process as we lead up into that. Also, OCI staff does participate on monthly calls with the NEIC and SOCIO, during which we have an opportunity to hear updates regarding federal laws affecting the marketplace enrollment and eligibility. And we're also able to address questions directly to SOCIO, which is kind of helpful during this process. So those are just a few of the areas that OCI is working in currently with regard to the health market in Wisconsin. And now I'm going to turn this over to Anna or Claudine for the DHS update piece.
Thank you so much. You know, it's been a pleasure and an honor to work with OCI and all of you over the last year on this initiative. I think Governor Evers has made it clear on numerous occasions how important this issue is to him. And it's more important now than ever with the pandemic. I think the pandemic's really spotlighted how crucial it is that our two agencies, DHS and OCI, really cooperate along with all of the key stakeholders. Just as an example, when the pandemic started, there was a Facebook Live event with representatives from both DHS and OCI, which really got a great reaction to have both sets of experts there answering questions directly to people seemed to really make a positive impact. So we know that this is a powerful partnership and we're fully invested in continuing it. Right now, open enrollment is just around the corner. It's top of mind for everybody. DHS has lots of plans and preparations in the works, and I will allow my colleague Claudine McCarthy, who is our communications director, to give a more detailed update about that in the work group report out a little later on in the agenda. But first, I believe that Allison from Covering Wisconsin will be going over preparation for open enrollment. So I'll turn it over to you.
Thank you, Anna, and great to be here today. And yeah, so obviously we're a month out from open enrollment, a little bit less. So lots of things have been in the works for a long time. In some ways we've gotten a lot of experience already just with the changes in the pandemic and doing everything remotely. That for the most part will continue among our navigators. And I think it's a little bit of a mix depending on where people are located in the state, depending on what kinds of capacity they have within their agencies to do in person safely. But for the most part, we will be prepared to and are planning on doing things remotely and virtually as we have been over these past many months. I know that the work groups are going to be talking about some of their efforts as we have pivoted over the last few months from really focusing on COVID to focusing on preparing for open enrollment and making sure that all of the work groups in collaboration with each other can prepare as much as possible. For Covering Wisconsin's activities, we've really been focusing on doing promotions in, again, an environment where a lot of people aren't necessarily out and about in the way they used to be. And so pivoting to do things over TV and radio. And again, this is in coordination with the promotions and marketing work group, but also doing more flyering in places where people actually are going, doing some mailings and that kind of thing. I did also want to mention that we've been working quite a bit over the past several months to take a deep dive into the connector tool. And again, this is the tool that we have used over the past several years to help consumers in the state really easily find assistance that's local to their area. So they can just put in their zip code and they can find assisters who can serve them. You might think that right now local assistance isn't as necessary, and to some extent, yes, to some extent, no. I mean, it's always really important to have somebody who you feel like can understand what's going on with health plans in your area, knows the environment, knows the landscape. We've been looking at, specific to that, what are the areas of the state that could really use more assistance? And so to that end, have been really doing a deep dive into reaching out to organizations to make sure if they have a CAC available, that we list them. If they meet the criteria, that we list them. Same thing partially in conjunction with our work with the Capacity and Workforce Work Group, doing a survey jointly with Melissa Duffy of Common Ground as a pilot survey. So it wasn't all agents and brokers, but agents and brokers connected with Security and Common Ground Healthcare Cooperative to better understand how they are serving consumers that might be eligible for Medicaid and Marketplace. And then to also, for those who fit the criteria, to make sure that we could connect them with a connector tool. So we're in the midst of confirming all of those right now who did meet the criteria to, again, get them listed. We want to get as many assisters available and connected to consumers. So once all of that's updated, we'll be sending that over to 211 so that they can update their own databases, make sure that when somebody calls 211, that they can look and find somebody local to them. And we did a training with 211 last year. We're going to be updating that as well because as you all know, policies have been updated and changed. And so just making sure that they feel comfortable with some of the questions they might be getting from consumers. Some of the things, again, I don't want to go too deeply because I know that these will be mentioned by the work groups. And so I'll let them go into more details about the ways in which they have been helping those active in their work groups prepare for open enrollment. Yeah, I think the last thing I'll say is that both CACs and navigators are in the midst of doing all of their training and getting recertified for the year to come. So this is federal training and state training. We're doing the conference. We're in the last couple days of that. It's all virtual this year. It's been a huge undertaking, but thank you, OCI. You've been a big help in making sure that that goes off without a hitch. We've really updated the pre-licensing. We have 55 people who signed up for being pre-licensed to be a CAC this year, which is great. It's higher than it's been in years. Yeah, I think I'll leave it at that.
Thank you, Allison. Can I just remind everybody who's not speaking on the call to mute your mic because we are hearing some background conversation at this point. Next, we're going to go to agenda item 4, the working group presentations. And so I'm going to turn it over to Bobby Peterson.
Thank you. I get myself unmuted here. Thank you for the opportunity to discuss the work of the Workforce Capacity and Direct Assistance Work Group. We've been meeting regularly since last year, pre-COVID. We obviously pivoted and spent some time thinking about COVID and outreach and efforts, related to our workforce, related to COVID. But this presentation, I think, is going to be, really remarking on some of the things, the forward-thinking issues that we've discussed as a part of our work group. Next slide, please. This is the contributors and guests. We've cast a broad net to try and identify folks that can help us understand and inventory, do an environmental scan of the workforce and the assisters that are out there. This is, a big undertaking just to think about who's out there in the space that's providing assistance on access to healthcare and coverage issues. We didn't focus solely on the marketplace because we know that there's so many variables that exist within healthcare coverage, and just identifying the person and getting them to the right source of assistance, which could be a broker or an agent, it could be a consortium, could be a navigator, could be an ADRC or disability specialist or a veteran service officer in the county. So we pulled in a lot of folks, had guest speakers, Liz Hecht from the Children's Council talking about a No Wrong Door initiative to build sort of a ADRC type system for children with disabilities. Kate Schilling from GWAR, who talked a little bit about legal backup and some of the components related to the ADRC service structure. And then Doug Stubbe, who is the Pierce County Veteran Service Officer and president of the County Veteran Service Officers of Wisconsin, trying again to gather as much information as we could as we built some tools and created an environmental scan of existing resources. Next slide. So one of the big things that we developed, and we've shared this with the other work groups, but it's an ongoing process, is an environmental scan, resource matrix that we looked at to look at a gap analysis, to conduct some baseline inventory of some of the existing resources. It's very big. It's multiple tabs, and we could spend a whole session just talking about the resource matrix and what we've identified in Wisconsin. But we've broken it down into some main components. One of the tabs is a summary, which gives us a high-level overview of some of the existing organizations, services that they provide, and this includes some of the state agencies as well, and some of the programs within Wisconsin Medicaid and features of that, like the HMO advocates and the ombuds, and just resources that are out there for consumers that are having issues in terms of access to healthcare and coverage, as well as a lot of the traditional resources that we look at right now during open enrollment and throughout the year. But that consumer assistance inventory included 10 different categories of assisters, and there's different levels of assistance that are out there, from real basic information referral to more advanced technical assistance, legal backup. And I think as we look at some of the areas that we discussed and the activities we worked on, we thought about that in terms of infrastructure that Wisconsin has already built. For example, like the ADRC network that includes ongoing training, ongoing review, opportunities for legal backup and assistance at a level that some people might need. Not everyone needs that, we know. And so thinking about what sort of training inventory exists out there for different levels. One of the areas that we discussed quite a bit is 211, which is a great resource, but it might not necessarily be the best resource designed for what we're trying to accomplish. And we'll talk a little bit more about that, but how do we identify sort of a hub resource that really does focus on access to healthcare and coverage issues for people that can do some interviewing, review, and get people to the right place at the right time. Because of the complexities in healthcare, that's a fairly big task right there that we've identified as a part of our the resource matrix that we've developed. So I'll share that as an Excel spreadsheet to the rest of the group, but it's an ongoing work in process. Next slide. So the activities that we were engaged in included just the mapping. We helped to promote some collaboration and coordination between our groups, provide feedback to the data work group and outreach just in terms of some of the areas that we were seeing as a part of our work. We took a look at available technology, and Allison mentioned the connector tool. We looked at a tool at ABC for Health Users Advocates, which is decision support technology that really works sort of like TurboTax for health benefits, that we can do an interview of a client, gather key metrics, and then identify some of the services that they may require. We link that up with a federal poverty limit calculator to help us, identify income of the families as they report it and trying to get it as accurate as possible. It's sort of higher level review before you determine, are they going to be going to the marketplace? Are they going to Medicaid or other insurance assistance that they might need? We worked on developing this consumer assistance hub idea. This is something that I think emerged after many conversations and thinking about the need for some type of a hub that would provide measurably improved access to healthcare coverage. And I think we can do that. I think that there are ways for us to measure the improvement that we're making in terms of access to healthcare and coverage. I think we need to think about it not as a one size fits all, but that people are looking at this from information referral, mobilizers, that level, to more advanced technical problem resolution resources that might be also available to folks. Next slide. The workforce development and capacity, we looked at identifying the current resources out there for training, talked a little bit about that already, but at the 3 different levels. And then thinking about what are the ways, we are in a virtual environment, and some of this really is conducive to the current COVID, but also later on in terms of reducing certain expenses, providing a virtual environment for teaching and training. I know that DHS has experience with the worker web for training economic support workers. This might be a scaled down version of that, working with OCI and developing a hub that provides teaching and training at the 3 levels that we identified, from basic mobilizers to intermediate and advanced, and thinking about ways that we can use learning management system. We use a tool called GURULS that we built with NIH funds that does some initial competency assessment of learners. We have 3 domains of public programs, private programs, and skills that we look at to assess competency, to sort of understand where that individual is, and then help build opportunities for them based upon their learning needs. Is it a introductory learning, information referral, or intermediate or advanced? Because it's going to be different, what their role is and what their goals are. So we're focused on thinking about targeted, sustainable, measurable workforce training, and the educational opportunities out there to address some of the knowledge gaps that we've identified in the system, that there are some fairly significant knowledge gaps that exist out there, and that they fall disproportionately on health disparity populations. Next slide. So the consumer assistance is a recommendation looking at addressing service gaps, including the navigator, CAC, agent and broker services, looking at a virtually staffed year-round service, because we know that these issues emerge not just during open enrollment. There's changes in income. There are pandemics, hopefully not very often, but there's issues, seasonal employment. There are issues, back to school campaigns that happen all year round, that people need assistance in being able to get to a hub. I think that the WisCovered website is kind of part of that idea, that we could have a central repository of consumer assistance as well as teaching and training, that this virtual hub is available for both consumers and professionals. One of the reasons we felt that a hub was important is that we know that with 211, they simply don't have the staffing or time to do a warm handoff. And our work from on behalf of consumers, a lot of the feedback that we got from the work group is that a lot of consumers do need a warm handoff to make sure they make the connection to that other agency or to that service, and that there's someone helping them to make that connection, because it's very easy to get discouraged if you're dealing with poverty or mental health issues or just a very busy, chaotic life. Having that person to help you make those connections and get connected to the level of service you need is really important. We also know that at-risk consumers who are struggling may need some additional help with something that we call benefits coverage management service. I talked about this at an advisory committee meeting last year about benefits checkups that we're working on, and how you can help maintain a healthcare coverage record for an individual and follow up with them periodically to help them maintain a connection to healthcare coverage and keep that assistance level going so that they stay connected. Next slide. So the workforce capacity and competency recommendations, looking at ways of looking at existing technology, building off systems that exist, like we suggested with consumer assistance, online management, on-demand trainings for learners, after an initial competency assessment of where are they and what track do they want to get into, and to develop these learning tracks to accommodate some of the diverse needs out there, that range from basic to very advanced. Make sure that there's a shared level of competency. I think the pre-licensing and the review that OCI does is a step in the direction of thinking about how do we make sure that we have a competent workforce to provide these services. Continuing education as always, because we know these programs are changing all the time. And again, try and coordinate these services through a consumer assistance hub. Next slide. So our next steps are just to get some input and review from the council and from the agencies that are involved here, and help us think about an action plan for 2021. So I can answer any questions now, or we can reserve it for later if you want.
Did anyone have questions that they'd like to ask Bobby now, or? Okay. Well, also, you can type something into the chat if you want, and we'll have time at the end if you'd like to use that too. The next working group is the data work group with Melissa Duffy.
Thanks, Rebecca. I just want to start out by once again thanking the governor and DHS and OCI for having the foresight to establish the outreach partnership. And it has really allowed us to create a platform for some amazing collaboration and dialogue that has been going on in 2020. And I'm very thankful I get to work with so many amazing colleagues and volunteers and DHS and OCI staff toward the goal of promoting coverage, especially now. So I'm here on behalf of the data work group, which has a lot of great members that we talked about last time. The first slide I think we have up, I can't actually see the slide, is just a reminder of the purpose we've defined for the work group, which I reported on at our last meeting. And it really falls into three main categories. The first embodies performance improvement and finding ways to measure progress toward our goals. And the second category relates to gaps in data and identifying ways we might be able to fill those gaps. Well,
hey, Melissa, sorry to interrupt. This is Kelsey. I'm trying to get your screen up and my computer is just a complete, it's not working well. Would you mind just pausing for 1 second? I'm going to try to close out of here.
I wasn't sure if it was just me or if other people couldn't see it. So Kelsey, I'm just gonna quick finish talking about like the three categories of our purpose, if you don't mind, and then I'll wait, okay? So I think I mentioned that the first one is really finding ways to measure progress toward our goals through KPIs. The second category relates to gaps in data and finding ways to fill those, and to also support stakeholders with data. So all of us can do our jobs just a little better. So those are really the three main categories of our purpose that we've defined. And then I'll wait, Kelsey, if you want me to talk about the rest.
Melissa, this is Derek. I think we might have just lost her.
Oh, okay.
So if you want to keep going until we kind of troubleshoot.
I'll keep going.
I think I have the presentation, the final. If I do you want me to just share it?
I have it up. I can share it.
Okay, cool. Thanks, Stephanie.
We'll work it out. If it's not dogs barking, it's technical difficulties, right? There we go. All right, so could you move to the slide where it talks about deliverables?
Yes.
Okay, so I talked last time about these very specific 6 deliverables that we'd like to see come out of our work if we have buy-in from OCI and DHS on these. I'm not going to go through them again, but I wanted to let you know that since our last meeting, the data work group has done some work to try and position ourselves to be able to move forward on these to the point where we'll have something to show you all. Our work group has broken up into 3 smaller and separate work groups, each with a specific focus. And that allows us to really better organize around decisions and specific tasks that are going to have to be done to get us toward the goal line and be able to put something in front of you. So if you could move on to the next slide. So I was asked to talk about our accomplishments to date. And first, we presented a recommendation to OCI and DHS last April about how we might be able to work with OCI to get more timely information from QHPs in Wisconsin. Because unfortunately, the QHP data really only comes out once a year, like in March after open enrollment. And it was our expectation, especially with everything going on with COVID, that we could match up county by county data with unemployment and Medicaid data in hopes that it would provide some indication about where we might want to focus outreach and education in the state. And really find those places where people are falling through the safety net instead of into it. We're also in the process of refining 3 Tableau visualizations that are interactive with county drill downs. And we're starting to talk about how we might present and contextualize that data to ensure we're supporting outreach and coverage in Wisconsin. And now we have our first draft of our KPIs, which I think we will be presenting to you very soon. So looking forward, in the coming months, we're going to be discussing those KPIs with the other work groups and with OCI and DHS leadership to ensure we have alignment and buy-in. Because if the old saying, what gets measured gets done is true, we want to be able to make sure we're measuring the right things from the start. And then we're going to be talking about bringing you some recommendations around data gaps. We have a sub-work group dedicated to this, and they are making progress. And then we're going to continue to identify ways we can support the other work groups with data. A good example of that kind of work is what Allison mentioned before with a survey that Covering Wisconsin, Common Ground Healthcare Cooperative, and Security Health Plan were able to collaborate on. Really just trying to gain the perspective of agents in rural areas of the state where there were gaps in the connector tool. So we were able to support that work together and collaboratively, and that's the kind of things that we might be able to do some more of. And then finally, we'll do more work on our one-stop shop data dashboard that we hope will be helpful and actionable for stakeholders. So if you could move to the, oh, you're on that one, never mind. So the what's in our way. I will say, fully admit, and this isn't unexpected, it's really challenging to work on data reporting as a volunteer committee because data is both strategic in some ways and then highly technical. And of course, our committee meets once every 3 weeks. And as you can imagine, we can get in the weeds pretty quickly. So we try to meet this challenge head on by creating our sub-work groups. You heard earlier that Donna Friedsam and Allison are heading up the KPI subgroup. Kelsey, Avery, and Maggie Jo are heading up our gap and data subgroup. And then William Park Sutherland and myself are heading up the dashboard subgroup. And it's really a way to try and make more efficient use of our valuable resource of time. And then second, I would say a challenge is that we're reliant on OCI and DHS, sometimes for data, sometimes for staff time. And of course, everyone that's involved is very busy, whether we're talking those of us inside or outside state government. We all have our day jobs, right? So I would just say, soon we're gonna need really leadership from OCI and DHS's buy-in on things like the KPIs and the data dashboard so that we can really focus our work and ensure that resources that we need from OCI and DHS are available so that we can achieve our deliverables. So that we're really looking forward to that, and I'm happy to answer any questions that anybody may have. Or if anyone from the data work group has anything to add, now's the time.
And again, if there are questions, we can ask those at the end too, if people want to wait a bit. The next, I'm just going to move on to the next working group, which is Outreach and Education Work Group with Adam Van Spanker.
Okay, Stephanie, are you good with slides?
Yes.
Cool. Take that as a yes. All right, awesome. Yeah, so charter here, we established this early on. I think we started meeting in February or March. So this will be a little bit of review, and then I'll expand on some of the things that we didn't get to discuss last time. But the charter for the Education and Outreach Work Group is to gather state and other stakeholder organizations to identify and coordinate direct outreach, education, and support services to help Wisconsinites access healthcare coverage and services that they need, especially populations facing health disparities and inequities, which I think, as a charter statement goes, it's appropriately vague. It's a nice umbrella to cover any of the services or education or training we want to provide, and is a nice cornerstone for the work that we want to do with this work group. Next slide. So we established these project goals. A lot of them happen in coordination with the other work groups, which is really important. I want to kind of drive home a little bit this message that I think, well, Melissa did a nice job, I think, thanking everybody for their vision and putting this together, and incredibly timely with the pandemic going on, but it also kind of shot us in the foot a little bit on some of the work that we're trying to do, because I think that all of the work groups work together best. The way I think of it is, you've got the data work group that is gathering data and developing these tools and resources that the other work groups can then run with. The capacity work groups identifying resources and partners and people who can step up and do this work. The education work group is there to then develop the materials, the trainings, and go out and do that, while the promotions and marketing will then market those. And right now we're all a little siloed. And I think that ultimately we will be moving towards a better kind of integration of all that. I think we're well on our way there, but I think that kind of coming together is going to be the key to sustainability for us. But in our silo, we developed these project goals of the environmental skin, which is building on and contributing to the work that the capacity work group has done, but with more of the focus on assisting the outreach and education resources, and then making recommendations back to this group. I think right now we haven't been able to do enough there. We're still waiting on some of the data from the data work group and a few other pieces to fall into place so we can kind of identify those and then really make well-supported recommendations back to the group. And then with that is identifying the outreach and education gaps and finding out what we need to develop, and then developing and distributing those materials and resources to the different populations. I think that's the other piece that's going to be missing is, okay, we've got the materials, the gaps, what do we need, and then who needs it? How do we prioritize which disparity populations around the state really need this information or these materials, resources, and when? When is also a big component that I don't think is represented here. Developing sustainable strategies that improve communication to health disparity populations. So hopefully those conversations and activities will move the needle on some of these statistics and disparities we're seeing around the state. And understanding, unique questions that come up. I think the virtual conference that we've been doing has been really educational in that regard as well, identifying some of these questions that come up that I, just in my role, don't necessarily think of as actively as I'd like to. And then promoting the effective use of health IT and social media to implement and publicize resources and programs. This is kind of one that goes, again, working with other work groups. That's part marketing, that's part data and capacity. So I really think that our work group is kind of a linchpin between them and that they best work together. But we talked about this one, the last one here last time, which is the Project Goal Zero, which has been to disseminate accurate and timely information in response to COVID-19. We basically had to modify our work plan, add Project Goal Zero, and commit a significant amount of our time to doing this work, providing training and education around COVID and policy updates and things like that. But again, it's nice that these groups were in place, so we were able to do that. I think that was probably our biggest advantage of responding to the pandemic this year. Next slide. All right, so we highlights of our work. We developed and provided training for partners and professionals about COVID-19 policy updates. We did a series of 3 trainings around the different public benefits changes. We had the pandemic assistance and the CARES Act and how that factored into all the different programs. We have basically the duration of the public health emergency, different state programs actually being extended, or disenrollments are being suspended, things like that. And we did 3 trainings for partners. I think we had well over 100 attendees on each of those. We've been disseminating information to professional organizations and associations, so doing outreach to groups and industries that have been most affected by the pandemic, Tavern League, Restaurant Association. We work to get a lot of information out to job centers that we're doing these drive-through job fairs that were really successful. And then other groups we have queued up because we've been working, I've gotten some input from some of our Milwaukee partners, Milwaukee Enrollment Network partners, about manufacturers associations and things like that, where we can continue to do this work and basically get educational materials about health insurance, so people aren't just selecting COBRA, for example, when it might not be the most optimal solution for their situation of being laid off, furlough turning into a layoff, and being unemployed. So in addition to that, and kind of in between all of this other work, we're continuously identifying new and additional partners and agencies to participate in this work group. Earlier in the year, we realized, hey, we've got a gap in Milwaukee. We could use more representation from there, whereas the promotions marketing work group, I think, has good buy-in from Milwaukee, but it doesn't help us to have any part of the state unrepresented. So I think the next big piece of that is identifying rural partners and really seeing whose voice is missing. And we'll basically be doing that ongoing because more pockets of, underinformed and underserved populations, we find the more partners we're going to need to reach out to them directly. And then right now, our big focus is we're looking at the work plan based on the objectives I outlined previously to identify achievable Q4 goals and deliverables, keyword being achievable there, but also including preparation for open enrollment, and then continuing education around access to health insurance following job loss, the identification of future training and education opportunities, and really thinking about moving into next year as well, because pandemic has taken a lot of our attention, and rightly so. I also think the original vision, I've got in the back of my mind all the time, the original vision for these groups is kind of serving as a foundation for where we want to go next, what we can really do, and how do we get towards sustainability, because this partnership has a lot of people spending a lot of staff time and resources kind of investing in it. But, if roles change, if organizations change and adapt and develop, I want to make sure that these groups can stay active and functional and useful for the state of Wisconsin for as long as they possibly can. And that's kind of always in the back of my mind. Thanks, Stephanie. Collaboration with other work groups. So what we're doing next here is I want to improve the collaboration with the other work groups that I described, because that's really how the education outreach work group will shine, is by having this other capacity identified, by having this data. So we're going to be working with the data work group on reviewing those key performance indicators, working with marketing and promotions on their materials for open enrollment, and continuing that environmental scan. We also have kind of internal buy-in coming in from DWD, which has kind of long been one of our targeted groups. It underpins all of the work I just described around layoffs, furloughs, unemployment. So we're hoping to get a Department of Workforce Development, and also a representative, or at least a speaker from the Department of Public Instruction and other state agencies that kind of touch all of the different pieces of health insurance and the work we do. Because you guys, this is state representatives know this. You all kind of work together. Nobody's in a vacuum. Even if you're coming up with policies over here, they affect something over here. And those conversations, I would like to see them happen, certainly in my meetings. But if they're not happening in my meetings, I'd like to connect to those partners who are having those conversations. So we're looking at Q4 goals. Q4 goals preparation for 2020. And then the looking ahead, I think I described pretty well using the data from the data work group. Is the thing I'm most excited about to take the gaps identified in the lessons from the data work group and develop the new training and outreach opportunities for next year. And then what we need to be successful in the last quarter of 2020 and into 2021 is that data from the data work group. Additional resources and participation from new members in other areas of the state. So identifying partners both in other counties, but also from state agencies themselves. And I think that gets into my last point here. If nothing else, I think the thing that we would need to be most successful moving forward is buy-in from DHS and OCI, this group, the Advisory Council, about what vision and training education goals there are. I think that I would just like to make sure that what we're doing is aligning with what the state's vision was for this project, and make sure that we are addressing, if staffing is an issue, or there's a message that needs to get out. This group is the perfect vehicle for developing that and getting training out, and especially educating partners, but ultimately the public as well, which is what I really want to do. So yeah, that is pretty much it. I think the other thing, like certain things that aren't listed here, we helped route the HHS letter and did some recommendations on the January 31st piece of that. So Melissa Duffy and I were instrumental in getting that done. And then another thing that requires education outreach that kind of goes with the state vision piece here is the communication around, say, the end of the public emergency period, where, how is that going to be communicated to people whose coverage is going to be up or whose renewals are going to be up? How is that going to be rolled out month by month? And are there opportunities there to educate members of the public or improve communications or do trainings to key partners? And that's what I think we'll be starting with in 2021. So if you have any questions for me, I think the trend here has been to hold them to the end, but I'm happy to take them now as well. All right, hearing none, seeing none. Thank you very much, and we can talk more later.
Thank you. Thanks, Adam. And so now it's Stephanie for the Promotion and Marketing Working Group.
Yeah. So the Marketing and Promotions Work Group, we're a little bit loose on our purpose, but in general, it's, work with state agencies and stakeholders to create uniform health insurance messaging for statewide promotion of healthcare.gov's open enrollment period and Medicaid throughout the year. And of course, we had a lot of COVID messaging that we started with, but we're hopefully moving forward. So just really brief, the first few months, when we started meeting, we worked together to create strategies and messaging with a focus on insurance options during the COVID pandemic crisis, or when it started, I should say. And that led what was mentioned at the beginning of the meeting to the creation of wiscovered.com, which is the landing site. A lot of social media messaging that came out of both OCI and Covering Wisconsin. And then the creation of outreach cards. And those have already been, as Adam mentioned, those have already been implemented and used by the education work group. So now we're moving forward into open enrollment, and I'm going to talk individually about each of these components because open enrollment, the messaging, we want it to be as big as we can get it. So we've got, digital media, the online landing page, different types of promotions such as PSA videos. So I'm going to talk a little bit about each of those. The first thing is the digital media toolkit, which was put together by OCI and reviewed by the work group. And that contains press release templates, social media posts with graphic assets, such as moving GIFs and static image posts. It has an email signature graphic, actually a couple different options, an e-newsletter content, and a flyer. So that's going to be available shortly, and it'll be distributed via a press release, and also individual members of the work group will likely be releasing that. For example, Covering Wisconsin will mention it in a news blast out to all of our listserv members, and I'm sure other groups will be doing the same. And then there's been a lot of creation of social media, and these are the ones that are advertising the WisCovered site. And as I mentioned, a lot of them are available in the toolkit. So there's graphics, there's videos, there's GIFs. In addition, Covering Wisconsin will have a whole range of social media, both videos, GIFs, and different graphic posts. So a little bit more about the wiscovered.com site. It is currently being updated. So we've already all looked at the content to change to announce and talk about open enrollment. And here are some of the things that we're encouraging people to do. So maybe when they come on, you know, some type of encouragement to reach out to an expert if they need help. How encouraging them to update their information on healthcare.gov. Again, complete their application with help from an expert. Some people start the process and get confused or caught up and they're not sure how to proceed, and then they might need help to complete it. How to review their plan, and then learning more about Medicare open enrollment. So there is a link on the website to that. And that page will be available in English, Spanish, and Hmong. And it's going to be available sometime in the first weeks of October. We don't have a solid date yet. It takes a little bit of time to get all the translations prepared. Also, scripts were already created and approved and are being sent to be filmed with both the governor and the lieutenant governor. So these are 30-second videos that are encouraging Wisconsinites to sign up for health insurance during open enrollment. The call to action is the WisCovered site, and these will be used on social media. Something else that will be shared on social media are a series of navigator video clips that were put together last year, and that were on, last year they were on the DHS website, and these will be reshared again this year. And again, the call to action will be visit wiscovered.com. And something that the group has been really working on this last month or two is a statewide public service announcement campaign for both radio and television. So this has 3 components. First is radio ads are 15, 30, and 60-second long. And then there's a 30-second public service announcement for television. And then an additional component of that is social media, and that's a social media piece will be posted on all of those different stations. So either radio or television stations, it'll be posted on their websites and on their social media pages. So, and I'll just say one other thing, the radio ads are from the perspective of consumers. So it's more of that firsthand account. This is my experience. I recommend that you call. I guess we didn't put our 4 main messaging strategies in the presentation, if I remember right. Help is available with a real person. Prices might be cheaper than you think. Not in those exact words, but that's a general strategy we're looking at, than you think. The deadline is December 15th. I don't know if anyone else can help me with the 4th message on the spot. I can't come up with it. So we really focused on our main messaging in all of these scripts that we put together, and they're going to be recorded rather shortly. So our future recommendation is, again, we think it's very powerful having all of these stakeholders come together and collaboratively work on messaging for the entire state. It has been an amazing experience, and it's been helpful for everyone to hear the different perspectives of community organizations or state government or insurance companies, and really just come together to put together that messaging. And so we really want to recommend a continuing state investment in both staff time and resources to participate in the work groups. And that's all I have.
Thank you, Stephanie. Okay, so that brings us to agenda item number 5, which is setting a date for our next meeting. We've reached the end of this meeting. We're due in early January or early to mid-January 2021 for the next quarterly meeting. Does anyone have a suggestion about date or time on that? Okay.
Yeah, and this is Allison. So yeah, I would think that probably mid-January, if not a little bit earlier than that. I mean, I'm not expecting people to necessarily be going away, but still people need a break. And I know that's a crazy time of year. So I would advocate for early to mid-January. I don't recall, I'd have to look back at calendars to see previously. Obviously today is a Monday. I don't recall if we typically have them on Mondays, but sticking to some sort of general day and time of the week would be preferable.
And I'm just looking at the calendar. We have a January 18th. We could do, you know, that would be an option. It's sort of right around the mid-mark. We could do that at 2 o'clock, and Allison, like you said, that would keep it consistent with a Monday at the same time. Is everyone okay with just setting that now for now?
I believe that's
January?
Martin Luther King holiday, so the state
thank you.
employees would likely not be available if
Yeah.
others.
And that would be me, but who knew? Our other option in that, if we're looking at a Monday in January, would be Monday, January 11th or Monday, January 25th. Are there any thoughts about
I
that?
might recommend, this is Allison again, maybe the 25th, just giving people a little bit of time after the holidays to reconvene and prepare in advance of that. But again, that's my suggestion, open to what others think.
Are there any other comments?
I agree with that.
Okay. Great.
I also would, I know time is up. I would be interested in thinking about how else we can use the meeting besides doing these report outs without much interaction, and perhaps thinking about, you know, we will have been through open enrollment at that point, where we want to take this, what we're going to do next in terms of how the agencies want to use what the work groups have been doing, or and move forward with whatever next steps will be involved.
Yeah, I think that makes sense. Okay, so at this point, if people have suggestions or thoughts about where they want the next meeting to go, please feel free to send those. Kelsey, I hope that's okay if I volunteer you for that, Kelsey at OCI. And then we'll just plan on the January 25th meeting again at 2 o'clock in the afternoon. And get, at least that way people can get that on their calendars for a whole date. And that's it for today. We're at the end of our time. So thank you, everyone. I really appreciate your time and all the effort you've put into this. Thank you and goodbye.
Bye-bye.
Thank you.
Bye.
Thank you.